Hi, I am so sorry you're here at urgent care, but I'm going to get you taken care of as quick as possible. Can I just really quickly get your name? And your date of birth? Okay, perfect. Just so we can have that in the system. I know you were in a small accident. Are you by chance asthmatic? Yeah? I can kind of hear it in your voice, and some of it might be a little bit of panic, but it's okay. I have some albuterol here for you, and you can take this home. This has not been used yet. So I'm just going to shake it up for you. Okay. And you're going to put it over your mouth. Keep your mouth closed. You're going to push it down. I can help you. Push it down. You're going to take a deep breath in. Hold it for a couple of seconds. And then let your breath out. And then I'm going to do it one more time. Same thing. I'll talk you through it, okay? Don't worry. You'll be okay. All right. Open your mouth. All right. Deep breath in. Here we go. 1, 2, 3. Hold it. And breathe out. Okay, good job. We're going to do that one more time. You ready? All right, go ahead and put it over your mouth. And breathe in. 1, 2, 3. Hold it. And breathe out. Good. Okay, you'll be able to take this home with you. Let me know if you're not feeling any relief in a little bit. But don't worry, you're in very good hands. Let me get my gloves on. And we'll look at these wounds that you have. None of them, by looking at them, none of them look too bad. So don't worry. I've seen a lot worse. Real quickly, I'm going to take your temperature. Sorry, we got old school here. Okay, open your mouth. And we're going to put this under your tongue. Close your mouth. Just a little bit longer. Okay. No fever. That's good. Okay. And I real quickly want to make sure that you don't have a concussion or anything. I'm just going to check your vision. Actually, before we do that, because I know you are in a lot of pain, I'm going to go ahead and give you some pain meds. Okay. I'll give you your correct dose. Sometimes these are doctor proof too. There we go. All right, go ahead and take these. And here's some water. Okay. I'm just going to go ahead and give you a cold compress. All right. Just set that right there. Okay. Now I'm going to turn on this light. And what I'm going to have you do is just watch my nose, okay? Just look at my nose for right now. I'm going to have you keep your head straight, but follow my finger. Good job. Yes, very nice. Very good. Okay. All right. And last check. Tell me when you can't see my fingers anymore. Keep your head straight. Just look at my nose and tell me when you can't see my fingers. Okay. 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 All right. Good job. Last one. Yes. Okay. And last thing, can you tell me today's date? Perfect. Okay. All right. I just wanted to get that taken care of. So let's go ahead and clean your wounds here. We're going to start with the most painful ones. And keep everything sanitized. Okay. And let me just go ahead and clean those up. I know I'm going to be as gentle as I can. Let's use another one. Okay. All right. And we are going to use some numbing on those, the ones not near your face. Okay. On your worst gashes, we're going to use this numbing cream or numbing spray. The ones on your face, I'm going to get some spray on some cotton balls or a Q-tip, and we'll kind of clean those up, okay? I'm sorry, this isn't going to be the most pleasant thing. I'm going to go ahead and take that cold ice pack off. That should also help numb it a little bit as well. Here we go. That's a lot. Good job. Okay. We're going to give it just a second to kick in. And we're going to take that cotton ball. We're going to get some, actually we're just going to do some Neosporin. The ones on your face, those don't really need some numbing. I know they're going to be sore, but we want to make sure that we get those taken care of. Okay, just while the numbing is kicking in, these will be a little bit faster. I know. You're doing great. Okay. All right. Okay, let's see. For your face, there's just a couple that I want to cover up. These are great and waterproof. I think just two will be fine. these tiny ones could be a little tricky. They get stuck to me sometimes. And here's 2. Okay, and the other ones will be fine to just be left open. Don't want you to leave these band-aids on for very long either. Alright. And now for the bigger cut, what we are going to do, let me look in it real quick. Okay. And does that feel pretty numb around the area? Yeah, pretty numb? Okay, good. I'm just going to suture it up a little bit so you will have a couple of stitches. Here's some sterile sutures. Not sutures, my needles. Okay. Alright, and I'm going to go ahead and stitch that up for you. Okay? It's okay. Just look away. You're doing great. Good job. Just a couple more. Okay. All right. And let's go ahead. And we are going to bandage that spot up. Okay. I'm going to go ahead and bandage it up. Okay. Good job. I know it has to be a little tight. Just going to put some tape on it now. also mentioned it felt like you kind of pulled something in that area. So, what I'm going to do, let me also just double check. I want to make sure it all looks good into your face. Yeah, that's looking good. Okay. So we're just gonna do real quick physical therapy for that. I'm going to. Have you heard of a TENS unit? No? Okay. Don't worry. So it's painless. You'll barely feel it. We want it just strong enough that you can kind of feel something happening. But besides that, we don't want anything crazy. And so, I just have some ultrasound gel. This is going to be for these nodules that I'm going to put on you. These patches. Okay, we're going to take out the kit. Just the 2 pads will be fine. Okay. And then our TENS unit. Okay. Here we go. It is already sticky, but this